doctors who conducted insane experiments on patients. Imagine stepping into a hospital, a place meant for healing, only to realize you are part of a horrifying experiment. No consent, no choice, just the cold hands of doctors who believe they are above morality, above ethics. What if the very people sworn to protect life became the ones who destroyed it in the name of science? This is the chilling reality of some of the most insane medical experiments in history, cases where doctors crossed ethical lines, treating human beings like lab rats. From mind control to grotesque surgeries, these experiments push the boundaries of what we can comprehend. Let's uncover the dark truth about doctors who conducted insane experiments on patients. Case 1. Dr. Joseph Mengele, the Angel of Death. Our first case takes us to Nazi Germany, inside the infamous Auschwitz concentration camp. Here, Dr. Joseph Mengele, also known as the Angel of Death, conducted some of the most horrific medical experiments known to mankind. Mengele was obsessed with twins. He saw them as the perfect subjects for his twisted genetic research. He would separate twins, inject them with mysterious substances, stitch them together in grotesque ways, and even dissect them while they were still alive. One survivor, Eva Moses Kaur, recalled how Mengele injected her with a deadly disease and left her to die. When she miraculously survived, he simply moved on to his next victim. His research had no real scientific basis. It was torture disguised as medicine. Mengele eventually escaped to South America, where he lived freely until his death in 1979, never answering for his crimes. Case 2. Dr. Shiro Ishii, Unit 731's Horrors. While Mengele's horrors were widely known, few people realized that Japan had its own version of him, Dr. Shiro Ishii, the mastermind behind Unit 731. Deep in Harbin, China, during World War II, Ishii led a secret medical unit where thousands of people were subjected to inhumane experiments. He exposed prisoners to biological weapons, infected them with plague, anthrax, and cholera, and even vivisected them while they were still alive, without anesthesia. Perhaps the most chilling part? After the war, he was never punished. The U.S. granted him immunity in exchange for his research on biological warfare. His horrific discoveries were used by world governments while his victims were forgotten. Case 3. The Tuskegee Syphilis Study, a government cover-up. Not all horrifying experiments happened in war. Some were disguised as medical studies conducted by governments themselves. In 1932, the U.S. Public Health Service launched the Tuskegee Syphilis Study in Alabama. The goal? To observe the natural progression of syphilis. But here's the horrifying part: the patients weren't told they had the disease. For 40 years, hundreds of African American men believed they were receiving free medical care, but in reality, doctors were letting them die just to study their symptoms. Even when penicillin, a cure for syphilis, became widely available, doctors refused to treat the patients, just so they could keep studying them. This experiment only ended in 1972 when a whistleblower exposed the truth. By then, many had already died, and others had unknowingly passed the disease to their families. Case 4. Dr. Ewan Cameron, the Mind Control Experiments. Imagine walking into a psychiatric hospital for depression or anxiety, only to be turned into a human test subject for mind control experiments. This was the horrifying reality for patients at the Allen Memorial Institute in Canada, under the direction of Dr. Ewan Cameron. Funded by the CIA, Cameron ran the MKUltra project, attempting to erase and reprogram human memories. Patients were subjected to small blue diamond electroshock therapy at 40 times the normal level, small blue diamond forced drug-induced comas for weeks, small blue diamond continuous loops of disturbing audio messages. Many forgot who they were, suffered permanent brain damage, or became mentally unstable for life. Even worse, the CIA later admitted to funding the project, but no justice was ever served. Case 5. Dr. Walter Freeman, the Lobotomy Butcher. One of the most infamous doctors in medical history is Dr. Walter Freeman, the man who popularized the lobotomy, a procedure meant to cure mental illness by severing connections in the brain. Freeman would insert an ice pick-like tool into a patient's eye socket and wiggle it around to destroy brain tissue. No anesthesia. No proper surgical environment. Patients were often awake, held down by nurses. Over 4,000 lobotomies were performed, including on children as young as 4 years old. Some patients became vegetables, others lost their personalities, and many simply died on the operating table. Despite the clear evidence of harm, Freeman continued his work for decades, destroying countless lives in the process. These cases force us to ask, at what cost does medical science advance? Some of these experiments contributed to medicine, but at the price of countless innocent lives. Today, medical ethics are stronger, but history proves that the line between science and cruelty is easily crossed. What other medical experiments might still be happening behind closed doors? Let us know in the comments. Which case shocked you the most? Do you think unethical experiments still happen today? Push pin like and subscribe for more chilling true stories from Dark Truth Daily.